So this is the modified Epley maneuver for posterior canal BPPV. So you'll start with your patient here, and we're going to swing her legs up on the side of the, or right on the foot of the table here. She's going to stay seated, so I'll keep a hand behind her here. The patients tend to want to go ahead and lay back, but we're not quite ready for that yet. I'm going to slide this pillow down a bit as well, just so we can get a little bit of a better angle. We want the pillow to be right here on her back, on the higher part of the back, so her neck can kind of gently hang off the back of it some. We're going to do a right head turn to the right, modified Epley. We're going to lay straight back, and she'll get that good angle with her head here. What we're looking for here is that rotary torsional nystagmus. So if she had right posterior canal BPPV, we would see it here in this position. We wait until it fatigues, and then usually I'll add an extra 20-30 seconds so that we have enough time for the otoconia to move. The second position from here, I'll usually be behind the patient. I will have her turn her head at a 45 degree this way. So she was 45 degrees to the right. Now she is 45 degrees to the left. We'll hang out here for about 30 seconds. At this point, she's going to roll over onto her left side and be mindful of the edge of the table. We're going to have her turn her head down towards the table. We're going to hang out here for about 20-30 seconds. Sometimes the patients will feel vertigo here and you might see some nystagmus. If so, just wait until that fatigues. And then from here, I'm going to have her tuck her chin into her chest. She'll swing her feet off this side of the table, sit straight up, and she'll keep her head down as we come down. So I usually keep a hand here and a hand here on the back. We'll hang out here for about 30 seconds, and then we'll bring her head straight back up. If the patient feels any dizziness here, I'll usually have them put their head back down, but then we are completed with this maneuver. Okay, so now we're gonna do a left modified Epley maneuver. So the patient's gonna start on the side of the bed, and she'll swing her feet up onto the bed. Stay seated, so we'll keep a hand right back here so that she doesn't automatically go back. Again, we want the pillow here so that it's on her shoulders and her head will gently recline right off the back of it. We'll have her head turn 45 degrees to the left, and we're gonna lay straight back. The patient will stay in this position for at least 30 seconds. Typically, we're looking for that rotary torsional nystagmus. We will wait about 30 seconds after the fact. And then the second position here, we're gonna turn her head 45 degrees to the right. And again, we will stay here for about 45 seconds or 45 seconds, waiting for any nystagmus. Usually there's not any here. So if we see it, we want it to fatigue. If not, we can move to the next position. From here, she's going to roll onto her right shoulder, being mindful at the edge of the table and nose straight down towards the table. Again, we're going to stay here about 30 seconds. Sometimes the patients feel vertigo and you may see nystagmus, so wait for that to fatigue. And then from here, we're going to tuck her chin into her chest. She'll swing her feet off this side of the table. She'll go straight up, keeping that head down. Again, I keep a hand right here, hand on her back. What we can also do sometimes, I'll add a little bit of a head shake here just to move any otoconia that are trying to move back into the vestibule. And then we will go straight up.